you ask the average woman, what is the most common cancer killer in women? She will invariably say breast cancer. If you ask the average man, what is the most common cancer killer in men? He will invariably say prostate or colon cancer. They're always very surprised to learn that lung cancer is the most common cancer killer of both men and women. Not only in Virginia, but in the United States and across the entire globe. This holds true regardless of your race or ethnicity. In our country, each and every day, lung cancer kills more men and women than all of the cancers of the breast, prostate, colorectal, and kidney combined. Lung cancer kills twice as many women as breast cancer, and 3 times as many men as prostate cancer. In fact, one American is diagnosed with lung cancer every 2.2 minutes, and one American dies from lung cancer every 3.3 minutes. In Virginia, lung cancer kills 3 times more Virginians than any other cancer. Unfortunately, lung cancer is a sneaky disease. It often lurks in the shadows, producing minimal or no symptoms for many years, until it's very far advanced. Most patients already have locally advanced or metastatic disease the very first time they see their doctor with symptoms related to lung cancer, such as a new or worsening cough, coughing up blood, or unexplained weight loss. Only about 15 to 25% of patients have potentially resectable early stage disease confined to their chest at that time. The key to beating lung cancer is to find it early, while that lung cancer is small and confined to the lung, and when our treatment options and potential for cure are greatest. Fortunately, we now have a screening test that can help us find small early lung cancers, and it only takes about 7 seconds to perform. Let's explore whether lung cancer screening is right for you. The pros and cons of lung cancer screening, how it's performed, what will you be looking for, the treatment options available to you should we find something worrisome, and if you are interested and still smoke, how we can help you kick that habit as well.
VCU Massey Cancer Center has been a designated cancer center since 1975. And what that means is that we bring the best of research, clinical, and education together to really serve the public. But I want to really say one thing about lung cancer. COVID has taught us one thing, that as we've been focused on COVID, it turns out that our attention to prevention and screening efforts have actually gone by the wayside. Not because people are bad, but simply because we have all as a nation been focused on COVID. It's time to get back to screening. Why am I so proud about being the Cancer Center Director here at VCU Massey? Because we have one of the premier early lung cancer detection screening programs in the country. And honestly, when we talk about the call to get back to screening, it's not just about breast cancer. It won't just be about GI cancer. It will be about lung cancer. Why? Because not only can we screen for your cancer, but we now have miracle therapies, molecular targeted therapies, immunotherapies, that even with advanced stages of lung cancer, we can give you a fighting chance. I'm proud to be part of VCU. I'm proud to be part of one of the best early lung detection screening programs in the country, and I'm proud to serve you.
How do I know if lung cancer screening is the right test for me? Well, the most common cause of lung cancer is cigarette smoking. Actually, about 1 out of every 16 lifelong smokers will eventually develop lung cancer. Stopping smoking greatly reduces your risk. If you are a current or former heavy smoker that is between 50 and 80 years old, you may be eligible for lung cancer screening. What is a heavy smoker? Someone who smokes the equivalent of 1 pack per day and has done so for at least the last 20 years. How do we define a former smoker? Someone with that same smoking history that stopped smoking within the past 15 years. As long as you are physically willing and able to undergo a potentially curative surgical removal of a lung cancer if found on the screening examination, and you meet these criteria, you are eligible for lung cancer screening. In most cases, your insurance plan will cover the cost of getting screened without cost to you.
An important aspect of the screening decision process is a shared decision-making discussion with a healthcare provider prior to initiating screening. In this discussion, you and your provider can consider your individual risk for lung cancer and also discuss the potential benefits and harms of screening. Lung cancer screening with low-dose CT scanning has been shown to decrease deaths from lung cancer. However, there are potential harms to consider as well. These include false positive results that can lead to more imaging and testing, including biopsies. Overdiagnosis of cancer, anxiety, radiation exposure, and incidental findings are among other potential harms of screening, and so it's important to discuss these with a provider to ensure that screening is right for you.
What are the pros and cons of having a lung cancer screen performed? Screening means we are testing you for a possible disease while you have no clinical signs or symptoms of that disease. You have likely already had many screening tests before, such as having your blood pressure checked to see if you have hypertension, having your cholesterol checked to see if it's elevated, or a colonoscopy. Yearly pap smears and mammograms are other examples of screening tests. Lung cancer screening is likewise a test to look for early lung cancer before it has a chance to give you symptoms. The whole purpose of a screening test is to find a disease early on, when treatments may work better and the chance for potential cure is higher. No screening examination is 100% accurate. During a lung screen, we are looking for a spot or nodule in your lungs. Lung spots are very common. In fact, more than 90% of us have one or more spots in our lung. Are all these spots cancer? No. More than 90% of the spots we find are not cancers. Just because we find a spot does not mean you have lung cancer. We actually can figure this out by doing short-term follow-up screening tests over a period of 3 or 6 months, depending on how concerning that spot looks. Spots that look like cancers but are not actual cancers are called false positives. The false positives are seen in about 7 to 8% of screens, or 7 to 8 persons out of every 100 persons screened. Only about 1 out of every 10 persons with a positive screening examination will need to have a lung biopsy performed to see if that spot is actually a true cancer. It is possible that your lung screen could appear normal, but a lung cancer could still be present or missed. This is uncommon and is called a false negative screen. This happens about 6 to 7% of the time, or in about 6 to 7 out of every 100 persons we screen. This is another reason why it's so important for you to come back every year for your screening examination, even if the current one is normal. Now, not all lung cancers are created equally. Some behave more aggressively than others. Since the screening examination cannot differentiate bad-acting lung cancers from those that may not be as aggressive, in order to give you the best chance of potential cure, we must consider all lung cancers as bad actors and treat them accordingly. Another way you could look at this is we could detect a non-aggressive lung cancer that you could die with rather than dying from. This is sometimes referred to as overdiagnosis. This occurs with most any cancer screening test. Overdiagnosis may occur in about 6% of screening examinations, or in 6 people out of every 100 positive screens. Very high doses of ionizing radiation may possibly cause cancers to form in susceptible persons. Lung cancer screening does use a form of radiation called ionizing radiation. We are all exposed to ionizing radiation each and every day of the week that we have no control over. It comes from the Earth's crust and the cosmos above us. This dose is equivalent to an average of about 3.6 millisieverts of radiation per year in most persons. The amount of radiation that you'll receive from a screening examination is very low, on the order of about 1.5 millisieverts or less, depending upon your body, height, and weight. That is roughly equivalent to 6 months of normal background exposure that you ordinarily receive. The amount of radiation used for a lung screening CT is about 90% less than that of a normal routine CT exam. That is why it's referred to as a low-dose CT. Lastly, the lung screening examination also includes other parts of your chest and upper abdomen on which we may detect a potential problem or issue, related or even unrelated to cigarette smoking, and which may also require additional testing to be performed. Such will never be performed without your knowledge or permission. This is referred to as an incidental finding. Your healthcare provider ordering the lung screening examination on you will discuss these pros and cons of lung cancer screening as part of a shared decision-making process. The screening examination can only be performed once you and your provider have participated in this process, and you both agree to participate in the lung cancer screening process.
Lung screening is performed using a low-dose CT imaging technique. This is a non-invasive imaging study that is based on X-rays, which are a form of non-ionizing radiation. The low-dose technique uses up to 90% less radiation than a standard CT chest examination. A lung screening exam is quick and easy. The patient will lie on a table that will then move in and out of the CT imaging unit, which is a large donut-like structure. As the patient moves in and out of the machine, multiple X-ray beams and detectors housed inside of the imaging unit will rotate around the patient. All of this data is then processed by powerful computers, which create multiple two-dimensional cross-sectional images through the patient's chest. These images are sent to the radiologist workstation, where they can be interpreted and a report can be generated.
Let's talk about incidental findings. I'm making a comparison to other screening exams. In mammography, radiologists can only see the breast tissue. In colonoscopy, the physician can only see inside of the bowel. A lung cancer screening CT scan includes an area from the base of the neck to the diaphragm, the heart, great vessels in the chest, parts of thyroid gland, lymph nodes, esophagus, bones and muscles and lungs are all included in that CT. Even parts of the liver, pancreas, adrenal glands, and kidneys can be included. A radiologist can detect some of the abnormal findings in the body parts that are in the CT. Those abnormal findings, some of them can impact the participant's health and has to be treated. Examples: emphysema or fibrotic lung disease of airways. One of the most important findings are calcium deposits which are on coronary arteries. This is a risk factor for future heart attack. All these incidental findings are reported to the referring physician at no extra cost to the participant.
So how we report the findings hinges on the screening exam. We follow standardized, structured way of reporting the findings seen on the screening exam, which is referred to as Lung-RADS system. So there are different categories within the Lung-RADS system based on the size, density, and interval changes of the pulmonary nodules. Based on the Lung-RADS category, there are different management recommendations. Either follow-up, different study evaluations such as PET-CT, or biopsy. For example, in the category of Lung-RADS 2, this means benign appearance or behavior, and the patient can return back to the annual low-dose lung cancer screening CT after a year. However, in the category of Lung-RADS 4B, this means suspicious findings, for which additional diagnostic testing or tissue sampling is recommended.
VCU Massey Cancer Center has been designated by the National Cancer Institute since 1975. That means we are in the top 4% of cancer centers nationwide and meet the NCI rigorous standards for research, education, and training, including in the area of lung cancer. With our early detection lung cancer screening program, we are committed to increasing access to individuals most at risk throughout the communities we serve across Virginia. Another way we move the needle is by being a leader in science and clinical research. Clinical trials are critical for discovering new treatments for cancer and new ways to detect, diagnose, and reduce the chance of developing cancer at all. As we also place a greater focus on enrolling a more diverse patient base in our clinical trials, we have a hand in breakthroughs that will enhance and save money, and most of all, save more lives for all people. Today, Massey is reimagining what a cancer center is and will be for generations to come.
We at VCU are at the forefront of performing minimally invasive surgery for patients like you with lung cancer. In patients who have an early diagnosis of lung cancer and patients who are found to have an early stage cancer from the screening CT scans, surgery provides the best chance of cure and long-term survival. Our team of surgeons are all trained in the modern methods of lung cancer treatment, including robotic and thoracoscopic surgery. Our enhanced recovery protocols, called ERAS, are designed to get you on your feet, back home with your loved ones, and working within days of lung cancer surgery with minimal pain. Your hospital stay is usually 1 or 2 days. Our team of anesthesiologists, respiratory therapists, ICU doctors, nutritionists, and nurses are all trained to take care of you, and we are grateful that you have chosen VCU Medical Center for your lung cancer surgery.
At Massey, our lung cancer patients have access to our multidisciplinary team. This team consists of pulmonologists, surgeons, radiation and medical oncologists, all who specialize in lung cancer treatment. All of our patients are discussed at a weekly conference of these lung cancer experts. Each patient's case is reviewed, and we develop a treatment plan individualized for every patient. We also offer a wide range of clinical trials for patients with lung cancer. Clinical trials are how we find new treatments in the fight against cancer. At Massey, we have clinical trials available for patients with all types and stages of lung cancer. This allows us to provide the best care and most cutting-edge treatments to our patients.
As a nurse coordinator, navigator for the lung cancer screening program, my focus is to ensure the patient has a seamless transition along the care continuum as it relates to the screening and findings. Whether the patient requires an annual follow-up or a referral to a specialist, I ensure that all of the pieces of the puzzle fit together.
Smoking cessation and lung cancer screening go hand in hand when you're thinking about your health. While getting a lung scan is a good way to detect for lung cancer to treat early, quitting tobacco or staying quit if you've already quit is still the best thing you can do to prevent lung cancer in the first place. In addition, quitting smoking can significantly decrease heart disease risk related to stroke or other brain events, and reduce risk related to other lung illnesses like COPD. The truth is that doing something about one's smoking, no matter your health or age, is going to lead to health benefits. So whether you are thinking about cutting back on the amount you smoke, quitting completely, or staying smoke-free after quitting, our team here at VCU Health is here to help you. Following evidence-based guidelines, we know the best chances to help someone quit smoking is a combination of medications like nicotine replacement therapy or Chantix that reduce tobacco withdrawal symptoms, and behavioral counseling. But even if you're not ready to quit and have not set a quit date, we encourage people to still seek support and counseling, because the counseling will help you take the time to think about your reasons to change your smoking if that is what you want to do, and to prepare you for life without tobacco. Some of the prescribed medications allow you to take them for a few weeks before your quit date, and this is a great time to start reducing your smoking. There are a couple of ways to get help with your smoking here at VCU Health. Depending on where you get your lung scan, you may be able to talk to one of our tobacco treatment specialists or counselors as part of the I Can Quit program during your clinic visit. If not, we encourage you to ask directly your care provider or nurse to give you a list of local and national resources and to talk to them about the use of pharmacotherapy. One other great free resource is to contact the National Telephone Quit line at 1-800-QUIT-NOW, which is a free 24/7 resource where you will work with a trained counselor on behavioral strategies to help reduce or quit your smoking. You may also contact the VCU Health I Can Quit program, which offers individual telephone counseling up to 5 free sessions. We will teach you skills and tools to help you cope with cravings, identify and avoid smoking triggers, and manage stress. You can contact your care provider or email icanquit@vcuhealth.org for more information.
What locations does VCU provide screening exams? VCU Health currently offers lung cancer screenings at our following locations Monday through Friday: the Short Pump Medical Center, Stony Point Medical Center, the New Kent Emergency Room, VCU Health's main campus and Gateway Imaging. VCU Health is one of a select few medical colleges in Virginia that has achieved the title of Screening Center of Excellence. Receiving this designation means that your organization recognizes the importance of providing responsible, high-quality, low-dose CT screening for early detection of lung cancer. This was done in collaboration with the American College of Radiology, the National Comprehensive Cancer Network, and the International Early Lung Cancer Action Program to create best practices and the highest quality standards for service delivery. VCU Health's guiding principles for patient-centered care, quality standards assist in the early detection of lung cancer, which directly contributes to improved long-term survival rates in the community. Future locations will be opening later this year at our Adult Outpatient Pavilion, Monday through Friday, 8 a.m. to 4:30 p.m., and at our Tappahannock location in early July, Monday through Friday, 8 a.m. to 4:30 p.m. The VCU radiology team has been working closely with Tappahannock leadership to verify all practices and protocols meet SCOE standards.